Hello and welcome to this brief video explaining the Clinical Encounter Sheet which you will submit as an assignment for your end of rotation portfolio, but also will be assessed on in a dedicated OSCE station in your summer assessments in 2017. First of all, for the assignment, make sure that for every page you include your student ID number, submission date, circle which rotation you are in, name your tutor, and then I'll explain as we go on what the clinical encounter sheet entails. First of all, it's to be filled in during your clinical postings. It will contain a total of 9 cases which you encounter in practice. So that will be either in the clinic kesehatan, in the GP practice, and also in Hospital Kuala Lumpur OPD. You must anonymize the details of the patients using only age and gender. I know I say this for every assignment video, but it's essential that you do this. You must not use any other patient identifiers. Each case should be chosen not because it's something exotic or rare, and particularly not for that reason, but because it poses for you a clinical question learning need, something you didn't know about before that you now needed to find out information in relation to it so that you can resolve your learning need. So you must find an answer, and you can get this from a tutor, from a colleague, from a textbook, or a published review from Dynamed or Cochrane database of systematic reviews, etc. You cannot duplicate cases. That means that a case you've submitted already, you cannot then submit for another assignment. For example, a musculoskeletal case cannot be subsequently submitted as a medication review. It's vital that the answers that you provide in your assignment are your answers. That is, this is your account of what you have read and not others' answers cut and pasted into your assignment. All assignments must firstly be uploaded to Turnitin, and then once the Turnitin scores are finalized, the assignment is only then submitted to Moodle. You may submit to Turnitin as often as you wish, but once you are happy with your assignment and submit to Moodle, then you cannot any longer re-edit and resubmit on Moodle. If you are discovered to have plagiarized an assignment, it will receive 0 marks. Your portfolio will then be deemed to be incomplete, and therefore you will then be ineligible to sit for the end of year assessments. At RCSI Perdana, we take this very seriously, and plagiarism is regarded as fraud. The cases you submit are prescribed as such. There will be 2 chronic disease management cases, 2 acute illness cases, 1 musculoskeletal case, 1 obstetrics or gynecology case, 1 dermatology case, 1 mental health case, and 1 pediatric cases. In week 7, as you've seen in a previous video, you will submit 2 of these cases to your augmented teaching practice tutor. The 9 cases should be submitted according to the pro forma template shown on the next screen. It's not compulsory to use a evidence-based medicine PICO structure to your clinical questions, but we do suggest that you use PICO structure in 3 of them. Because clarifying a clinical question using the PICO structure is such an important skill, it's also examinable, and you can use your clinical encounter sheet to practice this. You will be assessed on these cases in the clinical encounter sheet OSCE station in the summer assessments next year. You should know the cases backwards and be able to answer questions without recourse to the notes. If you need to see the notes, you'll be given them, but for approximately 30 seconds. You cannot keep the notes during the OSCE station. In the OSCE station, you'll be asked to summarize the case, including the following: the history, the examination where appropriate, and the management. You'll be asked to identify your learning need and how you resolved that. You'll be asked to identify how this patient impacted on you and to describe a strength and a weakness of yours in this case. Please keep the content brief and succinct. In the OSCE station, you will be able to speak about the case, so there's no need to write too much content in your assignment submission. The following is the first template, and all the others follow the same pattern. So let's just briefly look at that now. This is the first case of your 2 acute illnesses cases. So you outline the clinical problem succinctly and briefly, examination findings if this is appropriate to the case. You then outline your management plan, use bullet points only or single phrases so you can expand on that in the OSCE station. You then outline your clinical question, and if this is when you're going to PICO, this is where you would outline the PICO structure for this question. You will then list the sources of information you have used to resolve your clinical question or learning need. And finally, you will give a brief summary of your answer to the question in your own words. Thank you.